Very good morning, everyone. Myself, Dr. Malvika. Today, we are going to discuss about the composite material. As we all know that in the recent era, the demand of the aesthetic dentistry is increased over a period of time. So the composite is highly demand material uh, as compared to amalgam and the other even the other tooth colored restorative materials. So the composite, first we should know that what is the definition of composite. So composite is nothing but it's a highly cross-linked polymeric material which is reinforced by the dispersion of amorphous silica, glass crystalline minerals, or organic resin filler particles. And it also has a short of fiber bonded to the matrix by by a coupling agent are called as the composite. So this is the short description about how the composite resin evolved from 1950 to 2020. So the first composite introduced in the field of dentistry from 1950, uh, which has a very rough surface, and because of its rough surface, it highly bond to the tooth structure. So to improve these component or to improve the property of the composite, they added something like the uniformly macrofilled self-cured composite around 1960 to 1970. Then 1970, the acid etching technique has come to increase the bond strength, especially with the enamel. But again, the disadvantage is that it is not able to bond with the dentin. So to overcome these property, they have come with a different type of composite material from macrofield, midfield, microfield, a mid hybrid, and the other. Recently, they came with a controlled low shrinkage composite, because the biggest disadvantage of the composite material is with a polymerization shrinkage. So then also we have variety of composite based on their requirability: flowable composite, packable composite, and the controlled low shrinkage composite. Apart from that, there is a nano hybrid and nano field composite, and then the bulk field universal composite, which is the recent advancement of the composite. So coming to the composition of the composite, so it basically has the two main component, that is the resin matrix and the fillers. So the resin matrix is nothing but it's a polymeric cross-link material, polymeric cross-linking resin matrix, and in that it dispersion of the small silica crystalline and the metal oxide resin reinforced particle is also present in that. So to make these two component together, there we have some agents which is nothing but the coupling agents, which help in the bonding of the filler to the matrix. In addition, there is an activator and initiator system that convert the soft moldable filling material to the hard durable restoration. And there are combination of the pigment to match the color to the tooth structure. And then we have the additives includes UV absorber to improve the color stability, and inhibitor to extend the storage life and increase the working time for the chemical activated resins. So now coming to the basic composition, like the basic composition of the composite, that is nothing but matrix. So the matrix also evolved from the back here to now. Like before, we have the bisgama, which is nothing but the bisphenol A glacidyl methacrylate, and then we have the urethane dimethyl methacrylate, which has the more cross-linking, and it forms the more strong and rigid bond with a filler, and it also shows the more durable bond, and durability is increased with this UDMA. Now coming to the filler is nothing but to give more aesthetic or to accept it by all the tooth structure. So we incorporate 30 to 70% volume, or from 50 to 85% by weight, the filler particle. So the main function of the filler is to withstand the chemical, physical, and mechanical challenges of the oral environment. For example, what are the fillers we have? So we have quartz, amorphous silica, and barium glasses. There are trade-off among workability and durability and the aesthetic when filler are incorporated in a resin. So basic functions of filler is that it reduces the polymerization shrinkage. It also reduces the thermal expansion and contraction. It decreases the water absorption. It controls the workability and the viscosity. And also, in some extent nowadays, the biomimetic kind of composite has came into the market, which shows the fluoride release and anti-carcinogenic composite. Now coming to the coupling agent, as I told you, the basic function of the coupling agent is to bind the filler particle to the matrix thing. And we have, there is a organosilane agent which is help to bind these two material, and most commonly used coupling agent is organosilane coupling agent only. And what is the meaning of proper coupling is that it is extremely important for the clinical performance of the resin based composite restorative materials. And it also help in to improve its physical as well as mechanical property of the composite, and it prevent the water absorption and prevent the water penetration in the filler resin interfaces. Now the next composition is the inhibitors. Inhibitors are added to resin system to minimize or prevent the spontaneous or accidental polymerization of the monomer. This prevents the initiation of the monomer and subsequent chain propagation. After all of the inhibitors is consumed, the chain propagation can begin. A typical inhibitor, butyl hydroxy toluene, which is used to concentration on in the order of around 0.01% by weight, and thus inhibit have two functions: to extend the resin storage life and to ensure the sufficient working time. Now the other composition is the optical modifiers, which helps to increase the opacity, and also like for example, we are adding the titanium dioxide and aluminum oxide to composite in a very small amount, around 0.001% to 0.007 percent of by weight. All optical modifiers affect the light transmission through the composite resin with a darker shade, and opacifier should be placed with a thinner layer. And this considered has added important when a bonding agent is covered by composite layer. Now the classification is the classification of the composite material is classified based on their particle size. So the traditional, we have the macrofiller, which has the 8 to 4 micrometer, and then the nano hybrid, which is zero point 0.1 to 2 micrometer, and then the microfillers, hybrid, and nanofillers. These are the basic classification based on the particle size. Now the other is the based by the curing method. So we have the light activated, chemical activated, and the dual cured resin material. And another classification based on the filler size. So the same with as the composite particle sizes, the filler also classified into the macrofill, midfill, small, fine, mini filler, microfiller, and the nanofiller, which range from 10 to 100 micron to 0.005 to zero point 0.1 micron. So another classification based on the manipulation characteristic. So the flowable, packable, and the bulk fill composite. And another classification is by based on their clinical use. So the composite with a smaller particle were used for the anterior restoration. Because of the particle size, it is small and more uniform, so aesthetically it shows more brighter or more accurate for the anterior teeth. That's why it's used for the anterior teeth or the aesthetic teeth. But we can't use such material for the posterior tooth application because of their mechanical property. It decreases its compressive strength, so because of that we can't use these material for the posterior tooth. And in opposite, the composite who has the larger particle size or the higher filler loading, we use the hybrid composite in cases where we need to fill the class 1 and the class 2 composite resins. And the flowable composite resin or the universal bulk fill composite, these are the recent advancement. So the fillers are basically used to act as a base or the liner, and the bulk fill where we are not, we should not use the composite, or we are not uh, we not apply the composite in a layer wise. In bulk fill, in a one set of the composite, and then you have to cure all set for the your restoration is all set. Now coming to the another, like the biggest disadvantage of the composite is that the polymerization shrinkage and their workability. So to overcome these disadvantage, they come up with a recent advancement by the unique properties of the composite. So the first is the low shrinkage composite, which shows the polymerization shrinkage very less. And then the bioactive composite, as I already told you, the which is nothing but where we have the fluoride accomplish the composite resins, so which shows the anti-cardiogenic effect also. And the self-adhesive flowable composites. Now, these all are the properties of composite restorative material. As we see here, the traditional one or the unifilled acrylic has the size of the resin matrix is very big, and it's not uniform. Whereas the recent advanced flowable hybrid composite, if you see here, the particle size become very less, like zero point 0.6 to 1 mm, and the packable hybrid composite has a fibrous in nature. Now, other than that, we have the inorganic fillers. So the inorganic filler, as compared to the traditional one to the hybrid one, the volume percentage is become less, and also in cases of the larger particle size, we need more inorganic filler particles. Now the compressive strength is now the compressive strength is more in cases of